what is the functional medicine approach to fertility management? So within the NHS or within conventional medicine, even within fertility clinics, they usually are quite hormone focused. They try to do all the obvious things which all of us know about to get you there. Within the functional medicine clinic, we take, I would say, 3 steps back or maybe 5 steps back. We do quite a lot more. So there's, of course, the hormone balancing side of things, which has to be done. We do it perhaps a little bit differently using bioidentical hormones. Majority of patients will have something or other out of whack here. And so this is something we really need to look at and make sure you're okay. Then what about your other hormones? And this is a place which is quite frequently missed because usually someone who's familiar with working with sex hormones and not familiar with working for something, say, like your thyroid hormone or other hormones in your body. So this is also another area that we can look at, looking at all your other hormones, managing it at the same time. Then in order for all your hormones to work properly, your nutrition is really, really important. We have to absolutely make sure that's okay. You don't have unnecessary inflammation going on. And are you repairing well? Are you repairing well? When do you repair? Majority of repair takes place when you sleep. What's your sleep quality like? If it's poor, we need to find out why. If everything seems to be okay, you're eating really well, your hormones are fine, you're having your periods very regularly, you're still not getting pregnant, what's going on? This is where you've tested your partner, he seems all right. What's going on here? This is where we need to delve in a little bit deeper. We need to ask the questions like, what are you as a host like? Is there something a bit more hidden that would possibly be in you but maybe not in someone else? And this is where DNA testing specifically for fertility becomes really, really important. It's very targeted. It's designed specifically to address certain issues. And this is where we could possibly find things like maybe you have a tendency to not process certain toxins in the environment the same way another person does. So you might live perhaps near a farm and exposed to things, something like pesticide. Maybe I'm able to remove it properly out of my body, but what if your DNA states that you can't? That is something that we can look at. That's also something that something can be done about. So that's just a small example of the DNA, but there's so much else that the DNA can look at. How's your body getting rid of all the junk that we are exposed to on a day-to-day basis? What's your detoxing capacity? Is that a silent inflammation causer that that we should really look at and then try to remove? That's something else we need to look at. How's your body handling hormones that's been used up and it's now time for it to go? Are they able to detox and get rid of those hormones in the way that it should, or is there a block somewhere? That's something else that within functional medicine we can look at it. Inflammation being such a huge topic needs to be looked at. And infection, low-lying silent infection where, if you do normal testing, you may not have symptoms, you don't even know you have an infection, but it's there, it's silent, and it's there. Vaginal health can be impacted here. It can go much higher, creating a host that's not conducive to a fetus and an implantation to happen. So when we talk about a functional medicine approach, these are some of the areas we look at. There is a lot of work that can be done in order for us to try to find a cause for why you're not getting pregnant and do something active about it.